At the Region 5 Public Health Training Center, we are HRSA funded, and for many years we've had a really great connection and partnership with NNPHI. They approached us probably about this time last year to work with them as a subrecipient of their funding in order to engage in some proactive TA. NNPHI, knowing that we already have great relationships with the 501 health departments that we serve in the 6 Region 5 states, we felt like it was just a really great way to leverage our existing partnership and to work to advance the strategic skills of those that are in our region. So we have a sense of where there are gaps and needs around training and workforce development through assessments that we conduct, through the Public Health Workforce Interest and Needs Survey results that we are also a part of. And essentially, we decided to expand upon a project that we initially did in 2022 to build out a more robust and updated set of model job descriptions and job postings. We have worked with a couple of amazing consultants, Dr. Heather Krasnaw and Kimberly Green-Warren, to build upon an original set of evidence-informed job descriptions and job postings. And really these tools are meant to be templates, a starting point for those working in local, state, tribal, and territorial public health departments as they are really working in a difficult environment that we're living through right now to attract and recruit well-equipped folks to fulfill roles in their agencies, and then also to retain those folks to make sure that we are not continuously facing the turnover that our field has unfortunately been experiencing the past few years. We just recently launched the updated set version 2.0, and it's freely available. It is aimed for PHIG recipients, but it's actually available for anybody. They don't have to be a PHIG recipient as long as they're working in governmental public health and don't want to reinvent the wheel. This is a tool that's freely available and accessible to them. I haven't had the ability to work in a local health department, so I cannot imagine the amount of constraints and pressures that are faced on a daily basis, especially if there are staff capacity issues, just not having enough folks in the health department, especially in an under-resourced department, not enough time, or not even knowing where to start, perhaps. Working from a template hopefully is going to make things more efficient. It's a starting place where folks can go in and customize according to the needs and specifics of that agency, of that role in particular, and then the needs of the community that's being served. All of the templates are evidence-informed, so information has come from specific job task analyses, from input from folks that have worked in those roles. We've even integrated feedback and comments from actual practitioners in the region since version 1.0 launched in 2022. So we're hopeful that, let's say there's a rural health department and there's one person who's the HR director and also doing 5 other things. They don't have to do the work to determine, where do I start? How do I make a public health nurse job description that's detailed, that really gets to those core duties, responsibilities, knowledge, skills, and abilities? They can work from a standardized template that we have and then just customize it. So hopefully that helps save some time, that they can then put more of that time and energy into the recruitment and promotion with that short and sweet job posting, and making sure that they can then work with the employee that fulfills that role to actually work towards growing to meet all of the requirements and needed duties that that role is trying to fulfill. I know that roughly from 2022 until about midway through this year, 2025, we had, I believe, around 1,500 distinct downloads, and we know that those are coming from Region 5 states, the Great Lakes states, but also from across the country. So we know that folks are accessing and using it. We know anecdotally that people have found them helpful and that they are going and customizing those postings and descriptions. Public health is already facing a lot of constraints. Let's work smart and not hard, and make sure that we're attracting people that have the right skills, that are interested in working in public health and serving those in community, and getting those people that have the motivation to do hard but important work in the communities that we're serving hopefully means that we get those people to stay in their roles so we don't have turnover. There are two ways that people can access. If they want to peruse the Region 5 Public Health Training Center website, they can go to rvphtc.org, or if people want to go directly to the Model Job Descriptions Project 2.0 webpage, they can go to bit.ly, that's bit.ly/phmjd, and then 2, the number 2. So bit.ly/phmjd2.